Did you know that 1 in 2 people who are sexually active will contract a sexually transmitted disease by age 25? The San Francisco AIDS Foundation provides unique services that are geared toward people who are at higher risk of contraction or have contracted HIV. I'm a public health major, and last May I gave a presentation on HIV. And what fascinated me about my research is that I learned that there seemed to be specific factors that would correlate with having a higher risk of contraction. This created what we call in public health vulnerable populations. There are a lot of people that fall under the vulnerable population category for contracting HIV/AIDS, which is why I think it's so important for us to provide prevention for them. In this presentation, I will introduce you to the specific vulnerable populations we're talking about, how the San Francisco AIDS Foundation addresses those vulnerable populations with their services, as well as why you should help. So first off, we have to identify the vulnerable populations and ask ourselves why this is important. So the vulnerable populations seem to correlate with specific factors such as sexual orientation, race, and drug-using habits. Homosexual and bisexual males seem to be disproportionately affected, as well as intravenous drug users, and African Americans, as well as Hispanics. In an HIV.gov statistic in 2018, they revealed that 69% of the diagnoses were African American and Hispanics, and only 31% of the population they made up. In a 2020 fact sheet by UNAIDS, they revealed that 500,000 to 970,000 people worldwide died of AIDS in 2019. But there is a way that we can help these vulnerable populations. What we can do is offer organizations like San Francisco AIDS Foundation, and they basically offer preventative services. The medicinal ones are preventative pills such as PrEP or PEP, which are basically pills that people take if they are planning or already have had sexual contact with somebody who does have HIV. They also provide non-medicinal services as well. That is testing, vaccinations, as well as safe sex supplies. And support geared toward vulnerable populations. They also provide support. Basically, they term these communities, so support groups. And some examples of these are people over 50, people living with HIV, as well as queer and trans people of color. They also offer syringe exchange programs, which are geared toward the IV drug user population. Basically, they give these people clean needles to use to keep them from sharing needles and spreading any bloodborne illnesses such as HIV, because these practices will happen regardless of legality. In the academic journal, Legal Space for Syringe Exchange Programs and Hotspots of Inject Drug Use Related Crimes, they talk about the effectiveness of these syringe exchange programs by all the case studies that have been done. So creating more access is a trademark of these organizations, such as the San Francisco AIDS Foundation. So with this foundation, we can improve the health of vulnerable populations. We can do this by giving them access to education about safer sex practices and safer drug use practices, as well as education about HIV and other viruses as well. They also offer better access to care, so not only can they get this knowledge, but they can also have the opportunity to implement it in their lives. So today I introduced you to the vulnerable populations of HIV/AIDS, as well as how the San Francisco AIDS Foundation meets those needs of those populations. And now we're going to talk about how you can help. So the San Francisco AIDS Foundations offer a lot of ways to get involved. You can enter their text messaging system and get access to legislation that you can comment on, as well as petitions that you can sign. You can also work at AIDS Foundations in Texas. There are locations in Austin, Houston, and San Antonio that I have all linked in my presentation. So these are all ways that you can help without making a dent in your wallet, and I want you to consider how we can all make a difference. Together, we can make the world a healthier place. Thank you. I'll now open up the floor for questions. Yes. Okay, so the question is, do syringe exchange programs actually encourage intravenous drug use? And the answer to that is actually, that's a common misconception. The answer is no. And basically, there's been a lot of case studies done, and all of them have proved the effectiveness of decreasing the HIV diagnoses rate. And they have all proved that intravenous drug use does not increase during that time that the syringe exchange program is put in place. If there are any more questions, I'll be in the back. Thank you.